This conference will now be recorded.
Hello again. Welcome back. And now we're going to get into final expense field underwriting and how to properly quote. We're going to take a look at benefit design, common health conditions, and best practices. And as we begin all these modules, I do want to remind everyone to silence all mobile devices. And if you can, please put them away. Sometimes with the vibration, it could disturb your neighbor, and we certainly don't want it to do that. No talking during the training sessions. Please take notes, which has been the trend for everyone. Write down any specific questions you have. And as always, we want to create an open discussion environment. If you feel at any given time you could add some value or you want to share some real life experience, we welcome it with open arms. So what we're going to touch on a little bit about is benefit design and more importantly, the stages of our benefits. The best benefit to the client, of course, is going to be the level benefit. It provides first aid coverage for health and accidental related deaths. For some of our carriers, they separate it to preferred or standard. For other carriers, they just have a level death benefit. It really means the same thing. The only difference between preferred and standard with level is the pricing. Preferred generally is the lowest cost, and standard is generally a higher cost due to either tobacco use and or minor health conditions. Graded is going to be the next level, and the way that graded benefit will work is in the first policy year, 30% of the death benefit will be paid out if it's a death related to health, 70% in the second year, and then beginning on the first day of the third year, so that's 24 months and a day, 100% of the death benefit will be paid out for a health-related death. And at any given time, 100% will be paid out for accidental death. Moving down the TRO, we have modified death benefit. Um, Two of our carriers do offer a modified death benefit, and a modified death benefit has the appearance of a guaranteed issue. It looks like a guaranteed issue. If you take a look, 110% of premiums are paid out as a death benefit for the first 2 years for any health related death, and 100% of the death benefit is paid out due to accidental death at any time. They look the same, but they do not issue the same. Guaranteed issue is available to anyone. There are no medical questions. Modified death benefit does have some limited underwriting. And the reason that we put this ahead of guaranteed issue is that in some cases, not all, but in some cases, a modified death benefit is priced more competitively than a guaranteed issue, simply because there is some limited underwriting. So order of operation is going to be level, then graded, then modified, then guaranteed. Our object is to find the client level benefits. It doesn't necessarily mean we can. If we can't, the next best is going to be graded. Our goal will be to find that. If we can't, then the next best is going to be modified. And then finally, after that, it's going to be guaranteed issue. It's also important that you guys have some medical terminology. The two basic terms that we will be discussing in this office often, and that you'll have to understand in order to do the medical underwriting is going to be what's considered chronic and what's considered acute. What is a chronic illness and what is an acute illness? A chronic condition is a human health condition or disease that is persistent or otherwise long lasting and it affects or a disease that comes with time. The term chronic is often applied when the course of the disease lasts for more than 3 months. Okay, a common ailments that you guys will come across, guys and girls, that are considered chronic are going to be diabetes, Parkinson's disease in the middle, and then end stage renal failure being a bit more severe on the chronic side. Chronic just means that more than likely you're not coming back. COPD is considered chronic. Parkinson's is chronic. You know, once you're diagnosed with this stuff, you're not coming back. You got it. You got to manage it. And then there's what's called acute illness. In medicine, describing a disease as acute denotes that it is a short duration and as a corollary of that, of a recent onset. And a good example would be pneumonia, hepatitis, and common cold. These are all curable, they're situational, and then when they happen to the individual, they can be treated. So it's important to know the difference between chronic and acute, very, very important. And then also it's important to know some common health conditions that we see in final expense marketing. Probably the biggest one you're going to come across, first and foremost, is going to be diabetes. And diabetes can either be treated with a pill, insulin, or a combination of both. Things to remember when you come across somebody that's diabetic, they almost always have hypertension. It's hand in hand. So if you're communicating with somebody and they tell you that they've been diagnosed with diabetes and you ask them what do you take and they say just a pill and you say that's it and they say yep, that's it, more often than not, that's just not it. More often than not, they have hypertension. I can tell you almost always when they're on insulin, 99 out of 100 times, they're also taking medications for their heart. It's a hand in hand thing. Even if they tell you no, they absolutely are. They may not take it as prescribed. They may not wake up in the morning and put the pill into their mouth on a daily basis, but they are definitely diagnosed with hypertension and possibly other heart ailments. What you want to do when somebody's diabetic in a very soft, polite, professional way is you want to probe them. And if you ask somebody a direct question, do you have diabetes with complications? Almost everybody's going to tell you no, because complications to them means that their blood sugar shot up and spiked, so they almost passed out. They had to go to the emergency room because of their diabetes, or they're sitting in a doctor's office and the doctor said, oh no, your diabetes are uncontrolled. But for the purposes of what we do in this office and working with clients with final expense insurance, diabetes with complications typically means neuropathy as the main one. Neuropathy meaning the major, major, major one. Kidney disease would be a second complication of diabetes. Okay. Amputation, if they lost their foot or their leg as a direct result of their diabetes. Retinopathy, which is an eye disease as a direct result of diabetes. Nephropathy, which I just said a moment ago is kidney disease. And then there's the more severe complications, which is insulin shock and diabetic coma. Insulin shock and diabetic coma, if people have come back from that, they are very lucky to be alive. So it's very important to know. For the purposes of what we do, if somebody has told you that they have diabetes, you always, almost 100% of the time, must ask them, do they take gabapentin or have they ever been prescribed gabapentin ever in their life? If the answer is yes, they have diabetes and they say, yes, I take gabapentin, or yes, I've been prescribed it in the past and I don't take it anymore, it means because they have diabetes with complications. The look back for gabapentin use is 2 full years. If they were not prescribed, nor did they receive and take gabapentin for a full 2 years, we can say no to the diabetes with complications. But if they did take gabapentin or were prescribed it, even if they were prescribed neuropathy for arthritis or fibromyalgia or for headaches or because their nose was runny or for whatever reason they give you, gabapentin plus diabetes equals neuropathy, which means complications. COPD, probably the second more common thing you're going to come across, which stands for chronic obstructive pulmonary disorder. It's typically the final stage of emphysema. And more often than not, it is a condition to former and current smokers. It usually leads to oxygen use, and most of them that are diagnosed with COPD are also prescribed an inhaler. It's important to know this because some of our carriers will denote specific inhalers such as Spiriva as a COPD treatment, even if the person says, no, I've never been diagnosed with COPD, and they take Spiriva, the carriers look at that as somebody who has been diagnosed as COPD. Heart problems come up a lot. The main ones are going to be atrial fibrillation, which is also known as AFib. That is where the heart flutters. Angina, that's where the heart does a different beat and missteps a beat, or there's a painful part of the heart. CAD, coronary artery disease, which leads to heart stents. Those are the most common. For all of our carriers, we're doing a 2-year look back. For our Miracle carrier, it's a 1-year look back. And atrial fibrillation typically isn't a problem as long as they've been under maintenance medication for a period of 2 years. Kidney disease comes up a lot, and we got to be really careful with the way that we ask this question. If you ask anybody over the age of 60, do you have kidney disease? Half of them will tell you, well, my doctor said something. And I operate with the mentality that if you were told to your face on a Tuesday afternoon that you had the word disease, if you were told you had a disease, you absolutely do not forget that. It is not something people forget. People that have diseases know precisely the diseases they have. So you might want to probe a little bit about the kidney disease. And the way that I like to ask the question is, has a doctor ever told you that you have the following? Cancer, unfortunately, we live in a world where cancer affects every family. I don't know any family that has not been either directly or indirectly affected by someone with cancer. And what we need to have is no treatments for the past 2 years. So that means no pills, no chemotherapy, no radiation for a full, complete 2 years. If we can get a full, complete 2-year cancer-free, we can place them with any of our carriers. Pain is a bit of a tricky conversation that we're going to have with people because we are in a mild epidemic out there with our narcotics. And the thing that we got to watch out for pain is chronic versus acute, as I explained before, and mild narcotics versus heavy duty narcotics. There's a complete difference between someone that takes a Vicodin every other day or so because their hip is a bit achy, getting up and down this flight of stairs, versus somebody that is on Oxycontin and fentanyl patches because their knees are ready to give out. There's a very big difference between those two people. The first one typically will be able to be underwritten. The second one will not be able to be underwritten. And then finally, what does not have an impact on final expense underwriting? And typically, controlled high blood pressure does not have an impact on underwriting. Cholesterol, anything that ends with a statin, acid reflux or heartburn, situational depression or anxiety. Okay, bipolar is different, but situational. Diabetes without complications, gout, sleep apnea, and cancer, heart, stroke more than 2 years ago. Again, although we do have a carrier that will work with heart or stroke. So I'm going to kind of glance over the break time, just kind of, guys, just don't mind, just remain in your seat and we'll kind of move right on to the next one. So the field underwriting process, and whether it's, you're out there in the field and you're on the phone, the process is the same. First and foremost, it's a yes, no to the medical questions. So the first thing that we want you to do is, as you're having a conversation with the client, we want you to consult the final expense underwriting quick guide. And what we did was we put together about 40 of the most common medical ailments that you'll get: aneurysm, angina, in alphabetical order, bipolar, heart bypass, cancer, cerebral palsy. And we want you to quickly take a look and see, just on a quick brisk, if somebody tells you a condition like, okay, I've had a heart attack. Oh, and my heart attack was 4 years ago. Quickly take a look at the heart attack area and see how our carriers will look at it. Or if they might have said, I had a heart attack. Okay, when was your heart attack? It was January of last year. So I look at the calendar, and January of last year was more than 12, but less than 18 months. So who's going to take me with a heart attack 18 months ago? Okay, America was the only one. So we quickly want you to scan through and look at the way that the carriers will take each of the different conditions. Okay, you can see Parkinson's, we have 2 carriers, they'll take them preferred or standard. We have 1 carrier that'll take Parkinson's graded. Okay, schizophrenia, a couple of carriers will take them preferred, 1 carrier takes them graded. Somebody who has seizures, okay, you'll come across somebody who has a history of epilepsy. 3 of our carriers will take them standard or preferred, level coverage. 1 of our carriers will take them graded. So very important, you quickly scan through the medical underwriting guide. And then the next thing we want you to do is to discuss and talk to them about their prescription medication. Now, on the intake form, we make it nice and easy for you, where you can list their medications on the form. Obviously, you want to list their medication name, the dosage, the frequency. Very important. Why do they take it? And then when do they start taking it? And what you really want to do is you want to start to get familiar with looking up all the medications if you're not entirely sure. Okay? And when you Google their medications and it comes up on the right-hand side over here, it shows you what it can do. It can treat type 2 diabetes. Okay? And you basically say to them, okay, you're on metformin. It looks like it treats type 2 diabetes. Is that why you take it? Okay. On the other hand, you may pull up a medication and the medication may come up and may have different reasons. Okay. This one says here it can treat high blood pressure and heart failure. Okay. High blood pressure and heart failure. And it could also reduce the risk of the heart attack. So if somebody told me that they were on lisinopril, I would say to you, do you take that for high blood pressure? They would say yes. And then I would say, it also says here it treats heart failure. Have you ever been told you had heart failure? Right? Do you see how I'm asking it? Have you ever been told you have heart failure? We want you to Google every medication if you're not sure. And we want you to ask them why they take it. How long ago do you think they first started to take the medication? You want to ask them if they ever took something different for this condition, especially if they have the history of heart problems. You can really pinpoint, that should say pinpoint, you can really pinpoint a person's entire medical life based upon the medications they currently take. The next thing we want you to do is we want you to utilize our software. So let me go back a page here. I'm just sorry about this, guys. Okay, so the software that we use is called Best Plan Pro. And Best Plan Pro is really, really good, where we can put in all of the person's information. Okay. So we'll start off with their age in the top left, and we'll say that they were born in 1955, June 17th, 1955. We'll put in their height, and we'll put in their weight. We'll say that this person's a male, and we're looking in the state of Florida. And we're going to see if we can get them $15,000 worth of coverage. And they shared with us that they've never used tobacco. They told us their medications. We have metformin, and they've been on this medication for a number of years. Okay, first prescribed, most recent fill. Now, you don't have to ask them the most recent fill on medications they're currently taking, but you do have to ask the most recent fill on medications that they don't take, like in my example before, gabapentin. If they took gabapentin in the last year, you absolutely want to enter it in to the analyzer, and then you would want to put the last time they filled it was last year. You want to put in the reason that they're prescribed to treat it. It gives you the main reasons that this medication is prescribed for. So in this case, it's diabetes. And then usually the dosage. So we'll say 1,000 milligrams. Okay? And then you save. And what happens is on the right side over here, the condition that you put in shows up with an asterisk next to it. Okay. And what that means is now you have to tell the system exactly what the true condition is that they take the medication for. Diabetes, juvenile diabetes, were they hospitalized to diabetes more than 2 times in the past 5 years? So in this example, we're just going to do basic diabetes. They've been diagnosed about 8 or 9 years ago. And over here, very important, and this is really mainly for heart attack, stroke, and cancer, but when was their last treatment, most recent event? So obviously somebody that's actively managing their diabetes, you would just use today's date, and then you would save. This particular person told me that they had a stroke, so I'm going to type in the condition stroke, okay? And a TIA is a mini stroke, a CVA is a regular stroke, and remember, we want to put in the last treatment or most recent event, and this person told us that they had a stroke 3 years ago. So that's 2016. So you go ahead and hit save. And then this person also told you that they take Spiriva. Okay, sorry about that. S-P-I-R, S-P-I-R, see Spiriva, okay? They're all the same, so we'll do the Respimat. You see what it's used for, but they tell you it's for asthma. And it's hard to do the dosage for the Spiriva, but we'll say it's 300 mcgs. And then we double click the asthma. They've had the asthma for 10 years. And they would say that their asthma is mild. Okay. When all this is done and you've entered in all the information, and you're going to want to run a few test ones on yourself, you're going to run a few test ones on some of our existing clients to kind of give you guys an idea. You click Analyze Data. And over here, it's setting everything up. And then it tells you pretty much the carriers that we can use and the carriers that we can't. And if you can see here on the bottom, you probably can't, Royal Neighbors has been excluded because something about the stroke, the diabetes, the asthma, the medication puts this particular carrier in a knockout situation. Okay, so based upon this, we would look at these 3 carriers here: Liberty Bankers, Simplified, Prosperity, or American Eagle, and you would use these quotes here as the baseline to begin quoting out your client. And remember, we do silver, gold, and bronze, and silver is always the level that you want to try to sell them. So if your goal is to sell them $15,000 in coverage because that's what they want and that's what you determined they needed, you start with the silver, then you do the bronze or the gold, whichever order you want to do. You write down the price, and then you do the gold. I usually go between $1,000 and $3,000 up and down from silver. And then you do the platinum. Platinum, I usually go pretty heavy. Again, because you never know. You never want to assume a buyer. And then it gives you the price. What we always suggest too is you want to save the data onto your PC. That way, if you ever have to enter it again, let's say that the client, for whatever reason, does not get issued as applied. They don't get approved as applied. And you want to move on to a different carrier, but you've already started talking to another client and you started to present to them, all this stuff is forgotten and it's gone. So you want to definitely type the client's name and you want to save it to your desktop. That way you can always upload it to the tool if you ever have to talk to the client again, and all your information will be already there. Okay, so I'm going to go and close on that. Best Plan Pro, that tool that we just looked at, is only 92% accurate. 92% is pretty good, but we want 100% accuracy. So the next thing you want to do is, once you've selected the carrier that's in their best interest, you want to look at the insurance company's specific medical questions, which you will all have in a binder in front of you. And the other thing you want to do is you want to quickly look and see how they view their medication guide. Okay. Again, we're working with a 92% success rate using the tool, but you always want to have a system of checks and balances in. And you always want to take a look and see how the different medications are stacked up. And Spiriva was the one medication that I threw out there that was pretty much um, uh, on the fence. And if you look here, Spiriva says that with this particular insurance company, it has to be standard ratings, okay, not preferred ratings, standard ratings, generally for the condition of COPD and emphysema. If it's for anything other than COPD or emphysema, then we can get them preferred ratings. But if this person has COPD or emphysema, then Spiriva would be a standard rating. So it would be a little bit more than a preferred rating. You always want to double check, because sometimes you might have a situation where a particular drug like this, which is typically prescribed for Parkinson's, sometimes is given to people with restless leg syndrome, will allow the medication to go through if it's for restless leg syndrome. That could be the potential 8% of the tool. And then here you can see, OxyContin. They're prescribed OxyContin. The only thing they're going to get with this carrier is going to be modified life. So very, very important. You want to go through the order of operations. First thing you want to do is you want to consult, while you're talking to them on the phone, you want to thumb through the cheat guide. Very, very quick cheat guide. Okay. Very, very quick, very fast, major conditions. The next thing you want to do is you want to Google all the prescription drugs that you're not sure of. You want to enter the information into Best Plan Pro. This is the tool that will help you out. And then you want to review them on their medication RX list to make sure that the medications are not on their knockout list. If you're still unsure at this point, that's not a problem. This is what we're here for. We will come and help you with the underwriting of that individual. Okay. The carrier underwriting process, so you understand how the whole thing works, is the carrier underwriting process when you live connect the person over. So now you've taken the app, you've gathered all their information, you got their bank account information, you know what first day the premium is going to come out. The carrier's process works like this. You have to ask them all the questions on the application first, because that is your requirement as an agent. The underwriter will ask all the medical questions exactly as written. They will run a prescription history report, and it will be run in real time going back 7 years. They will see every medication filled and electronically sent to a United States pharmacy, and they will see what physician prescribed. The MIB will check both health and life carriers. If they reported anything negative, especially if the prospect attempted to buy a Medicare supplement and was turned down. Very important. A lot of times these people have not bought a final expense policy, but they tried to buy a Medicare supplement last year or the year before, and they may have been turned down. Health insurance underwriting is way more difficult than final expense. And I'll give you an example. If somebody is a diabetic dependent on insulin, they generally cannot get a Medicare supplement policy if they have to go underwritten, but they can get pretty much almost any final expense policy. So if they attempted to go for a Medicare supplement, they would be turned down, and that reason for being turned down would be reported to the MIB. When the final expense carrier went in to pull the MIB check, they will see that the person was declined by, I don't know, Aetna or Mutual of Omaha. The underwriter will go back and review anything that is not consistent with the medical question, no answers. More often than not, I'm telling you guys, know this now. Clients forget what they were prescribed. Their old medications pop up, And then it comes back around and they start being asked questions about that. If the applicant is eligible, a decision will be made and communicated to you on the spot. If the applicant does not meet the carrier's criteria for either an offer for graded or modified, it will be made a straight decline. So what we have to do is we have to prep our clients that when we go down the road for this underwriting process, that it's very, 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 very important they tell you everything they know about their health. They tell you everything that they know about their previous health, every medication they were ever prescribed. They have to tell you this because here's what will happen. If they leave out a major heart medication, it's going to pop up and it might cause you to have chosen a different insurance company. And that's really what this is about. It's about choosing what's going to be the best insurance company for the client. So if we don't choose it in the right way, then we could potentially cause more harm to the client by sending them down the road to be declined. So I know that I breezed right through this. This is kind of the general overview. But once everybody has the Best Plan Pro set up on your computer, then we definitely would want you to start running some mock scenarios, and we'll run some mock scenarios in training. So at this point in time, this is a true break. We do want you all to really take that break and come back into the room exactly in 10 minutes.